Anita Anand is the Federal Minister of Procurement. She has been leading Canada's purchase of vaccine supply and the other supplies needed to distribute it to Canadians across the country. Minister Anand, first of all, good to see you again. Thanks for taking time to speak with me.
Great to see you too, Peter.
So look, we now have received more detail about the vaccine rollout in a briefing we got today from federal officials. Still lots of questions though, so let's walk through some of those. The general leading the rollout of logistics today, Danny Fortin, said he's looking at vaccines arriving from Pfizer in the first week of January. Can you confirm that date? Is that what we're looking at now?
Well, of course, we're working closely with General Fortin, the Public Health Agency of Canada, and the provinces and territories on this rollout. From a procurement standpoint, we are working with a Q1 of 2021 timeframe, and certainly deliveries will occur within that time. We also need to make sure that we have the provinces ready to receive the vaccines. And so General Fortin and others are going to be leading a stress testing exercise with them. But certainly we're working for the earliest possible deliveries within the first quarter of 2021.
Right. So those numbers have been out there, 6 million doses from Pfizer and likely Moderna between January and March. But the general's being more precise than that today. He's talking first week of January. Is that what you know to be the case?
Well, let me just take you back to our contracts, Peter, that are contingent on Health Canada approval of the vaccines. And so my preference is to ensure that we're abiding by the contracts, waiting for Health Canada approval, and then specifying the delivery time after that approval has been forthcoming.
Fair. Okay, so let's work with that then. Health Canada, the lead medical advisor at Health Canada is saying now, sometime in the next 10 days or so, within the next 10 days, Health Canada should be approving the Pfizer vaccine. So if that's the case, take us 10 days out, and then what happens on day 11?
Well, what happens on day 11 is that we firm up the delivery schedule with Pfizer, and we ensure that the provinces and territories are indeed ready to accept the doses. And then we begin rolling the vaccines out as soon as possible thereafter. It is a very complex procedure. As you can imagine, these Pfizer vaccines must be stored at minus 75 degrees Celsius. We're putting in place refrigeration contracts for 126 freezers in particular. And we are also ensuring that we have an end-to-end logistics provider in place to assist with the distribution effort. So this is an immunization process that has never occurred before in our country, and we've got to make sure we have all the pieces in place so that the rollout does go smoothly.
But you know the question everybody wants to know is when, and I know there's some difficulties in pinning that down. But here again today, now we have the general who's leading the logistical part of all this saying he's ready for, he's looking at January, first week of January. Jason Kenney said he's been told by federal officials it's January 4th. What day is it?
Well, I appreciate that there is that precision that is being requested at the current time, but I just want to be clear that I base my responses to you and everyone else on the contracts that we've put in place. And those contracts at the current time are A, contingent on Health Canada approval, and B, ensuring that we have the pieces in place to safely execute delivery. And those two things have not yet occurred. They are occurring and they will be in place, but we have to be careful to make sure we're providing accurate information.
Okay. And I want to make sure we're doing the same thing. So let's walk that along a little bit, because I think maybe we're getting to a useful place for Canadians. So based on what you've just said, you know, it's hard to pin down a date because we want to make sure we're ready to accept the doses, if I hear you correctly. The general said today, if I can, the general said today that he's working on making sure logistics are in place by December 14th. So that's a pretty short timeline. He talked about the fact there will be 14 ultra cold freezers, one in at least every province in the country, in that next 2 week to 1 month timeline. If all that's in place, is it your view that you can go to Pfizer and say, look, if you have doses for us now, we want them now first week of January? We're ready.
We're speaking with the vaccine manufacturers every day, Peter, to impress upon them how important it is for us to have deliveries as soon as possible in the first quarter of 2021. So yes, we are in touch with them on that basis.
And is that part of the conversation? First week of January?
Most definitely. But the reason that I'm not providing an exact date, Peter, is because there is uncertainty right now in the framework in terms of what date in particular Health Canada approves and what date in particular the stress testing has occurred to ensure that each and every province and territory is prepared and ready to accept doses of a very complex and fragile type of vaccine that we need to make sure we treat carefully.
And that stress testing you talk about is what the General talked about today, right? Tabletop exercises, dry runs in the provinces to make sure that, because what's kind of different about this, Moderna will deliver vaccines when they're ready to one point of drop in Canada. Pfizer is different, right? Pfizer's going to deliver these directly to each province, to these point of delivery points in the province. So that needs to be ready.
Exactly, and the provinces have been asked to provide the delivery locations to the Public Health Agency of Canada, and that process is underway. So it's very much a collaborative exercise between the Public Health Agency of Canada and the provinces and territories. Information needs to be provided to PHAC in order for PHAC to ensure that the country will be ready to accept doses when that time comes.
You talked about the 126 freezers on order. Do you know at this point whether that's going to be enough? Is that 126 freezers, presumably several of them, more than one of them in each of these sites in the provinces? Have you got enough, or is there more on order?
Sure. Let me give you some more details about our cold storage capacity. We have secured 126 Panasonic and thermal scientific freezers for ultra frozen and frozen vaccine storage. We have 100 minus 20 degree freezers and 26 minus 80 degree freezers. 42 of them have already been delivered and received, and those deliveries are continuing, and depending on the unit, each freezer can hold between 96,000 and 280,000 doses. This is in addition to 8 minus 80 freezers that have been leased and existing federal capacity. So all told, we have the capacity to store 33.5 million doses of vaccines, and this should be sufficient. Of course, we are also procuring dry ice, and we are exploring what freezer capacity the provinces themselves may have to supplement the existing federal capacity.
Just want to finish on this. The House is debating a motion from the Conservatives, supported by the other opposition parties, to compel you to produce a plan, a detailed vaccine plan on distribution, on who gets vaccinated first, and to do that by December 16th. Will you abide by that?
Well, listen, our goal is to ensure that this country is ready for the rollout of a vaccine. And so with regards to the question that you've asked, the National Advisory Committee on Immunization is providing guidance, but it's very much in the hands of the provinces and territories to decide which aspects and which parts of their population they wish to see immunized first, well, with the recommendations, of course, from the NACI as well as the Public Health Agency of Canada. But as you know, constitutionally, the provinces have the jurisdiction over the distribution of health services, and that is within their conduct and jurisdiction.
All right, Minister Anita Anand, thanks so much for your time again today. Good to speak with you.
Great to speak with you, Peter. Take care.